Welcome to Hashimoto's Unfiltered, real talk, real solutions. The podcast where we cut through the noise and get straight to the heart of living with Hashimoto's. My name is Dr. Ray Benedetto, your host, and I'm here to share my expertise, personal insights, and from time to time, conversations with incredible guests to help you take control of your health. Together, we'll explore actionable items, debunk myths, and navigate the complexities of your thyroid health. So whether you're newly diagnosed or a seasoned warrior, this is your space for unfiltered truth and real hope. Let's dive in. The topic of today is why testing, especially in the beginning, monitoring for sure, but definitely in the beginning, why it is so important to test thyroid antibodies. It's crucial. If you got no other test done, it would be the only test I would run on patients who we suspected to have thyroid conditions. And today you're going to learn why. And I'm going to arm you with the data and the knowledge that you need and the legs that you need to stand on to have this conversation with your doctors if they give you a hard time. I'm even going to give you a way that if they do give you a hard time and they won't test you, you can get it done for pennies on the dollar to get these tests run. So let's go. Now, what we're going to start with is, again, I want to emphasize how important it is. I know you have heard the opposite. I know everything you have heard from your doctors and from the medical world has been the exact opposite of what I'm going to say. They're going to say they're not important and that you don't need them. And the reason why they say that is, and I just had this conversation with someone earlier this week. The reason why they say that is it's not going to change their management or their treatment of you. And they're not wrong. It's not going to. So in their eyes, why do we need to run these things? It's not going to change anything that I do to treat you because they only have one treatment. And that is there's two treatments, two options. One of them is not really a treatment. The second one barely is. Number one is your thyroid markers, which when they say that, they're pretty much referring to TSH, maybe T4. Those levels are in range. So there is nothing to treat. That's it. You can have every symptom under the book. They run those tests. Those are in range. There's nothing to do. Option two, which is not helpful. Option two is we ran those tests. They're out of range, typically meaning your TSH is high or your T4 is low or both. And okay, now you have hypothyroidism, low thyroid or underactive thyroid. Here's Synthroid, Levo, Tyrosine, or whatever. Here are the meds, which are basically just thyroid hormone replacement that we're going to give you because now your thyroid's not making enough hormones on its own. So we're just going to give them to you. And what's that going to do? It's going to make those blood levels go back into range, and then they're done treating you. That's it. That is it. And I know you've all heard this before, the story over and over and over again. You've probably heard me say it over and over again, but that is it, gang. That is where it starts and ends in this country with the management of thyroid problems, particularly hypothyroidism. So nowhere in there was there any mention of an autoimmune disease that's causing it, which is most of the time. You're going to see that in a moment. An autoimmune disease that's causing the hypothyroidism, of which we need to check thyroid antibodies to look for. But nowhere in that situation I just laid out did you hear any of that. No. So when you educate yourself, hopefully through me, I think all the docs out there are going to get wind of me sooner or later that I'm building an army of you guys. So when a patient gets educated and then goes to their doctor and says, hey, we've already gone your route, like we're doing those things, and they're not working because I have still a terrible amount of symptoms. I feel horrible. I'm getting worse. You're telling me my thyroid's normal, or I'm on the meds and you're telling me that I'm in range and everything's fine. I did a little research and I found out about this Hashimoto's thing, which is an autoimmune disease, which causes this mostly in the first place. And can you please check me for that? I don't think we've ever been checked for that. I don't think you've ever sent me to get checked for that. And then the doctors go, nah, we don't need that. You're being treated. You have hypothyroidism. You're being treated. Your levels are normal. We don't need that. And again, the rationale they give, and I see you guys talk about this all the time. I just had a conversation with someone specifically earlier about this week, is because whether you have Hashimoto's or not, their treatment is not going to change. The scenario I played out for you is the only treatment they're going to do. So whether you have it or not, and again, as you've heard me talk numerous times, Hashimoto's changes the game. It's an autoimmune disease, totally different treatment approach, which we're not necessarily going to talk about today. But if you have questions on it, let me know. But that changes the game, but in our eyes, but in their eyes, it doesn't. So there's no need to check you for that because I'm not going to do anything about it, even if it's there, which is insanity because it's causing everything. So if and when that scenario plays out, here's the ammunition that you need. And I'm going to be giving you some snippets from a white paper that comes from a company called Vibrant America or Vibrant Wellness. They're a company that I use for functional medicine testing, all that kind of stuff. Again, not the point of today, but that's where it comes from. And it's a white paper, which is basically when someone does a white paper, they take a bunch of research, they read it all, and they summarize it. And they put it on a white paper because it's white. And I'm going to give you some snippets of that today to solidify the point of today's topic, which is why they're so important and why you need to bang the drum. If anybody wants it, I'll probably just post it anyway, but if anybody wants the paper, a copy of the white paper, I will give it to you. You can have it for free. It's not mine. I'm not charging for it. I'm just passing it along. I will give it to you. That way you will have it. Literally, you can print out a hard copy of it. All the references that have been researched are on the bottom of this thing. There's like 15 or 20 different references that went into writing this white paper. You will have all of those references. So you can walk into your doctor's office and be like, this is why I need my antibodies checked. And here's the research, and here's the data, and here's the proof why. And they're still going to look at it and go, I don't know what any of this is. They don't know the research. That's the problem. But now they can't say they don't have it because you handed it to them on this paper. Let's dig in. I'm going to read some snippets from it. And again, then I can supply it to you if you want it. Again, I'll probably just blast it out there anyway for everyone. The name of the white paper is called Thyroid Autoantibodies as Early Prediction Markers in Thyroid Disease, okay, by Vibrant America. It's a couple pages long, okay? Now, they give it a little spiel in the beginning. Here's thyroid disease. Most of it is caused by autoimmune disease in the case of Hashimoto's and Graves' disease, and they're caused by these autoantibodies, which we can measure in the blood. And again, they reference here that thyroid disease, while rarely life-threatening, like it's not going to usually kill somebody unless they get some kind of severe myxedema, coma, or a thyroid storm. Rarely is it life-threatening, but with the very small percentage of the time it can be, the overwhelming majority of the time, it is associated with a significant decrease in quality of life. You feel like garbage. Your quality of life is in the toilet. It can contribute to this thyroid disease in general, other problems. Graves' disease, it's eye problems or cardiovascular or neurological problems, skin problems, osteoporosis, neurodegenerative disorders. Having a chronic thyroid condition, metabolic syndrome can cause all of these other problems. So we need to handle it better. And again, what do they do? Typically, it's measured with TSH and T4 and T3. And there's a bunch of tests that can be done with a full thyroid panel, but they only do a small fraction of them. And there's a bunch of different stages where you have symptoms, but it's not showing up in the blood work and all that kind of stuff. Again, even more important as to what we're talking about today and why it's so important to check thyroid antibodies. Okay. Here is the bottom line. Timestamp this. I should timestamp what I'm going to say right now. And it's in this paper, and I have it highlighted. I'll share it with you. You can see it. Autoantibodies as early prediction markers in thyroid disease. Again, I'm going to literally read this right from the white paper. Even though thyroid disease is not life-threatening, overwhelming majority of the time, 99% of the time, early detection and treatment of thyroid disease would prevent long-term morbidity and mortality from things like cancer, osteoporosis, cardiovascular diseases, and specifically reduce the risk of things like miscarriages. Even in asymptomatic patients, if it's identified early and treated appropriately, okay? Now, this next part comes specifically from a study by Huftless et al. So et al. Means and others, which again is on this document. You can look at the research. It's from, I think, 2011. Showed that thyroid autoantibodies, mainly, there's two big ones, TPO So thyroid peroxidase antibodies, TPO, and thyroglobulin antibodies are present for up to 7 years, not days, not months, 7 years before clinical diagnosis in Graves' disease and Hashimoto's patients. So these antibodies, this is why I'm banging the drum all the time with you guys. You have to get these tested, have to get them tested. They can show up in the blood 7 years before a diagnosis of Hashimoto's or Graves' disease. So what does that mean? Shouldn't these antibodies be a first tier, a frontline screening test in conjunction with the TSH and things that they run? That would clearly serve as something that could predict or get ahead of thyroid disease in the future. So why wouldn't we run these antibodies as a matter of routine? Because they don't have a treatment, that's why. But this is why it's so important to ask, because up to 7 years before you become diagnosed, we can see these in the blood. So that would obviously help us. It would be helpful to monitor and prevent this long-term morbidity that we're talking about. Now, here's some of the proof that we're going to go over. And again, I'll share this with you so you can see it. But again, gang, this is why it's so important. Further down in the paper, they're talking about the results that they talked about. You'll see the results. You'll see the bar graphs. These antibodies show up before, well before fluctuations in TSH or fluctuations in even hormone levels, thyroid hormone levels. So you're going to see this. So the prevalence, for example, just the TPO antibodies, right? TPO antibodies were present in a significant number of patients before their TSH went out of range. So if we're only measuring TSH, we're missing almost all of it. We're missing it. At least we're missing it for a long time. So right here, and again, you'll see the graph. I'll send it to you. These are the results, so the results show, there's like these bar graphs. Here's what the results show. They prove that the measuring these antibodies is useful not only as an early predictive marker, but also as a secondary confirmation if someone has borderline TSH levels. Again, if your TSH levels are in range, your doctors are like, they're in range. Well, what if they're like barely in range? Run the TPOs or run the antibodies. So we see this so these tests would be very useful as a marker if someone's got really borderline TSH or subclinical hypothyroidism, where they're symptomatic, but they don't have the TSH elevated, telling us like, oh, this is going to happen, by the way, at some point. So why don't we get ahead of it? So again, these results were consistent. Huffless et al. was a big study where they confirmed that TPO antibodies were present in 66% of Hashimoto's patients and 57% of Graves' patients before 7 years of clinical diagnosis. They showed that the thyroglobulin, not as much as the TPO, which again, we see clinically. I have this with patients all the time. The TPO are more commonly elevated than the TG, but I've seen both. It's very possible to see one and not the other. But these are clinically significant numbers, gang. Clinically significant numbers. So you're talking anywhere from 66% to about 85%. And again, what they did was they follow these people. They follow the people in the studies. So they said, okay, well, these people have elevated TPOs or elevated thyroglobulin, but elevated TPO usually, and they don't have elevated TSH. So they're not clinically diagnosed with hypothyroidism, but they have TPOs in their blood. 85% of those people went on to develop subclinical or overt hypothyroidism. Gang, this is huge. This is gigantic. Okay, this is why it's so important and why I'm banging the drum all the time about this. Quick summary. The results, the conclusion on this white paper, which again is a summary of 8 different studies. I will share them all with you. They are all from 2000 and later. So from 2000 to about 2014 are all these studies, 2015. The results in this white paper showed thyroid antibodies have a strong early appearance in subjects who would then go on to develop subclinical or overt hypothyroidism and hyperthyroidism, and which will then has a high likelihood of eventually developing clinical thyroid disease. Hence, it would be beneficial to use anti-TPO and anti-thyroglobulin as a first-line screening marker in conjunction with primary thyroid markers, TSH and T4, to plan frequent follow-up testing and reduce long-term morbidity and mortality. That is what the research tells us. That is why I am constantly screaming about this, that this needs to be done. Because this is what the research and the data tells us. And your doctors don't know it, and they're not following it. And this information is readily available, and you're unfortunately suffering because of it. This is why it's so important to treat or to test these antibodies, because they will show up in the blood up to 7 years prior to you getting diagnosed, number one. They will show up long time in the blood before many times your TSH would go out of range. So by the time your doctor catches it and checks it, it's been going on for a long period of time. We can significantly reduce the morbidity primarily. Again, mortality is not super high with thyroid disease. That's death. Mortality is not super high, but we can significantly improve quality of life and significantly prevent long-term morbidity that's associated with thyroid disease by catching it earlier. That's what it's all about, gang. That's what the research tells us. That's what the data tells us. That's why I do the things I do. That's why I say the things I say. That's why I recommend the things I recommend. I'm going to drop this paper with this recording so everyone can have it. You can download it. You can print it. You will have it in your hands. You can read what I just read. You'll have all the references. You'll have all the ammunition you need to never have your doctor tell you no again. That like, no, we don't need to do that. Yes, we do. Here's the research that shows it. If you can't find it, if you're hearing this or you're watching this and you're hearing the sound of my voice and I'm telling you it's with this video and you can't find it, just message me. Wherever you're consuming my content, email, social media, whatever, comment, reply, you name it. I will get it to you. I will get it to you so you have it, okay? I'm going to post it everywhere, but that doesn't mean everybody sees it. If you can't find it and you're hearing the sound of my voice right now and you want it, let me know. I'm also going to give you a way that if you are having trouble getting these tests done, to get them done for a few dollars, not hundreds of dollars, but $1. And the way we're going to do that is I have a question I want to answer first, because I had a question that was submitted that I got earlier today, actually prior to giving this talk, which I was going to give anyway. And let me find it here. So that question comes from Janelle. And here's the deal. It is going to ring true with exactly what we're talking about today. She says, my primary doc won't test them, won't run TPO, thyroglobulin antibodies. I'm sure you've all heard this. He says, once you have them, they don't just go away. He's not wrong. He's not wrong. And all that matters is how you feel and if your thyroid is functioning properly. If you feel good and your TSH is normal, it's not worth checking. Okay. First of all, nobody feels good. They're not feeling good. Their thyroid and your thyroid's not functioning properly. Your thyroid's not functioning at all, which is why you're hypothyroid because of the Hashimoto's and why they're giving you the meds. So they're giving you the meds. Doesn't mean your thyroid's working properly. It just means that it's making your TSH back in range. So again, that's the story. I get it. That's what you guys hear over and over and over again. Hopefully you understand why that is not cutting it after today's talk. She says the TPO test also costs $120 and insurance doesn't cover it. So I'm going to show you a way right now to get it for not $120. And insurance doesn't cover it. It's not accurate. So the insurance will cover it. I send my patients to the labs to get this test done all the time, and their insurance does cover it if the doctor documents it properly. So if it's diagnosed properly and documented properly on the lab script, it will be covered. I have occasions where it's a hard time, pain in the butt, but if the doctor's doing their job, they can get it covered. So insurance does cover it. I'd like to know if my antibody numbers have changed at some point, though. Is there some company you recommend I can use to test them? That was the conclusion of Janelle's question. All right, listen, gang. There are, yes, you can go online and you can order these tests. You can pay cash. Here's the beauty that my patients get from me. And I'm going to give you a little nugget here for you, even if you're not my patient. You can get these tests run for cash. Okay. The TPO test for $8.33 and the thyroglobulin antibody test for $8.75. I did not do the math. I'm doing it right now. That is $17 and $2? $17 and $17. TPO for $8.33. Thyroglobulin antibodies for $8.75. Not that good at math. You're not listening to me for my math skills. $17. Sorry, 1708, I think. $17. What I do, I use FullScript, and if you have a doctor, they can do this. They can use other platforms. I use FullScript with my patients. It's an online dispensary that I can prescribe supplements for if somebody needs them, but I can also order lab tests. So I can order blood work for patients. I can order specialty testing, GI maps, Dutch testing. Like, I can order tests through this platform as well. And so I can order this test, or I can prescribe it to my patients, TPO and TG antibodies, $8.33, $8.75. So for $17, I can order these tests and prescribe them for them. They have to pay cash, $17 for them. They can get a script and they can take it to Quest Diagnostics. They are nationwide. There's Quest everywhere, all over the country. And for $17, you can get these tested. Okay. So go to your doctor. If you're working with another functional medicine doctor, they're probably using some similar platform or FullScript themselves. Ask your doctor. Again, they probably won't take the time of the day to even sign up for FullScript to help you out here, but it can be done for $17. Not $120, not $75, not $50, $17. Couple cups of coffee people are probably spending at Starbucks. $17 to get these tests done. That's doable. That's pretty much doable for everybody. Look, if you can't have it done, I'll do it. Just send me a message and I'll put you under my dispensary and I'll send you the things and whatever. Let's get it done, gang. You're listening to my voice right now. There is no excuse. I will help you. I can help you with whatever you need. I've been doing this a very long time. There is no way not to get these things done. You are listening to the sound of my voice right now. You are here. There is no excuse, A, not to get proper diagnosis, B, not to get proper lab testing done, C, not to be able to figure out how to identify the root causes of your Hashimoto's, D, I think I'm on D. You can figure out an AIP protocol. I will teach you an AIP protocol to help, which is an autoimmune protocol to help get everything turned around. I will help you do it. I will show you how to do it. Like, there's no excuse. If you want to get well, you can get well just being here and listening to the sound of my voice right now. It can all be taken care of. So, all right, I'm done soapboxing for today. Let's get to, I get all fired up. I was so excited for today because I hear you guys all day, every day coming to me with these complaints and with these challenges and with these problems. And I see you guys posting in the group all the time about this stuff. All of these challenges can be overcome. I will help you. Just ask. Just ask. If you guys need help with something, just ask. Don't complain about it. Just ask me, how do we do it? If you want to complain about it, that's fine. But the people I want coming to me are the people who are like, I want to do something about this. Like, we can complain, great, but then it's like, what's the solution? How do we do this? There is a way. There's always a way to do it. Just ask me. You don't have to be my patient. Just ask me for help or a solution to a problem. If you need it, it's there. And you're in this group now, so you have no excuse not to find it. Just ask me. I get it. There's a lot of functional medicine docs out there, people selling programs, charging for everything out the wazoo. I don't. You can schedule a consult with me. I don't charge for that. You want to be my patient? We'll talk fees. That's fine. They're super reasonable too. And I have plans and affordability for everybody because I want people to get the help they want and need if they want it and need it. I want to thank you for tuning in to Hashimoto's Unfiltered, Real Talk, Real Solutions. Again, my name is Dr. Ray Benedetto, and I hope today's episode helped to give you the tools and the insights you need to take another step forward on your Hashimoto's journey. Don't forget to subscribe, leave a review, and share this episode if you think someone could benefit. You can also connect with me on Facebook at Dr. Ray Benedetto and on my website, drraybenedetto.com. benedetto.com for more resources and updates. Until next time, remember, you're not alone and real solutions are always within reach. Take care and be well.